Right, so the actions of gravity on the body, especially an anatomical neutral position, and the anti-gravity muscles. So first, what is anatomical neutral position? And hopefully you're familiar with this, but just in case not, we're going to go ahead and review it quickly, because this is an important concept that you'll use throughout the whole course and beyond. So anatomical neutral is just this kind of standing upright position, feet slightly apart just underneath the hips. The most important thing to notice that might not be intuitive is that the arms are down by the sides and the palms are forward. So the palms are forward here with the thumbs laterally. So the head facing forward, just kind of standing upright with your palms facing forward. So that is anatomical neutral, or anatomical position might be a preferred way to say that, because it's not really neutral from a musculoskeletal standpoint necessarily, and every person is built a little bit differently, so it may not be the same for you as it is for someone else. And we do, in this anatomical neutral position, we do have the curves of the spine, so the curve of flexion, of hyperextension, flexion, and hyperextension again. So these curves are normal and are a normal part of the spine, and are considered to be like this for anatomical neutral position. Your spine may have more or less curve depending on stresses you've put on it, especially for dancing. Sometimes they can have less curve, but in anatomical neutral or anatomical positions, we do have these curves present to at least some extent in the body. So what happens? What does gravity want to do on the body? So when you're standing in that anatomical neutral position, if you had no muscles holding you up, what would happen? Well, here is my beautiful schematic drawing of what would happen. So you basically just kind of collapse down, your knees collapse inward, your ankles are going to flex, your spine flexes, and you just kind of collapse into a little heap on the floor. But let's go to a little more specifics about that. So what exactly is happening at these different joints? So if you released all muscular tension, what would gravity do to each of these joints? So what is the action of gravity at the tarsus? So the tarsus is pronation and supination. Those are the possible actions. So the action of gravity when you're collapsing like this is going to be pronation. Pronation. And similarly, at the ankle, when you collapse naturally, it's going to dorsiflex the ankle. So dorsiflexion, and flexion at the knee is going to flex the knee. And this should all make sense because when you're collapsing down, the knee is going to flex, obviously. The ankle is going to dorsiflex because you're collapsing toward the ground. It wouldn't make sense to plantar flex the ankle. At the hip, we have flexion, we have adduction. So flexion and adduction, the knees are collapsing inward. That one might not be quite as intuitive, but remember, just if you remember this position, or if you kind of stand in that, if you try to do this, just release tension cautiously. Don't let yourself collapse to the floor, but you should feel that your knees are going to tend to collapse inward like this. So we're going to have flexion, adduction, and inward rotation at the hip. So we've got three different joint actions going in on the hip, but if you just kind of remember the schematic of how it feels in your body, it should make sense. Your hip is going to flex, adduct, they're adducting, adding back together, and inwardly rotating. And then the spine is going to have this big old, basically all of it's going to flex. So your head's going to kind of fall to the ground right in front of you, and your whole spine is going to flex. So spine is flexion. And then what are the anti-gravity muscles that we use to prevent these actions from happening? So if we want to stand upright, we don't want all of this to happen, or else we just collapse in heaps to the ground. So we use muscles to hold ourselves up that are going to be the antagonistic muscles for these actions. So to prevent the tarsus from pronating, then we have to use the supinator muscles. Similarly, for the ankle, the ankle wants to dorsiflex, so we're going to use the plantar flexors, and same throughout all of these. These are the actions that gravity is trying to do. So we have to use muscles that have the opposite action to counteract the pull of gravity. So I'll go ahead and fill these in. So these are just the muscles that are producing the opposite effect as what gravity is trying to do. So as gravity is trying to do all these things to do when you're just standing up, not doing anything just other than just standing. So these are all muscles that have to be contracted to some extent, maybe not max contraction, but have to be contracted at least some extent continually just in order to maintain a standing position.